Hello, and welcome to EcoMap, the practical, easy, and useful ultrasound resource for general practitioners. This is the site where we talk about real and authentic clinical cases actually seen in a general practice office. And then, well, whenever I come across interesting or fun cases that could spark discussion or things that are particularly striking, I take the opportunity to talk about them on this channel. That way, we can learn together and check out some cool things in ultrasound. Right now, you can take advantage of a completely free ultrasound training. It's a great training with 18 modules where we talk about general ultrasound, laying a solid foundation to help you get comfortable with your ultrasound machine, even if you've never touched one before. The link is in the description. Today, our clinical case comes from a 78-year-old patient who comes in with a PSA level of 10. Just so you know, the normal is 4. So, for those who aren't familiar, and so at first glance, this suggests a likely severe prostate condition. So I decided to do a prostate ultrasound for this patient, not to look for a lesion, since ultrasound is actually a pretty poor test for detecting prostate lesions, especially via the suprapubic approach, but rather to assess his prostate volume so I could actually calculate the PSA density. That, on the other hand, is a pretty interesting indicator. And I was surprised to find in this elderly patient who seemed asymptomatic all the signs of a bladder under strain. That's why I decided to share this clinical case with you today, because a bladder under strain is actually pretty interesting to go into detail about, and it's important to know the semiological signs that help you spot it. So right away, when you start the exam, you immediately notice this huge prostate, right? With a significant intravesical protrusion from this adenoma, or at least the central adenomatous part, which is really prominent in the bladder. But what really interests us is this. Actually, right away, you notice that the bladder wall is extremely thick. This is already one of the main signs of a bladder under strain. In this patient, the bladder is full, and yet the wall still remains very thick. Now, be careful not to fall into the trap of a false bladder under strain. I'll mention it right away while I'm thinking about it. The false bladder under strain when the bladder's empty. A patient who comes in with a very slightly filled bladder can show the appearance of a false bladder under strain. But in this situation, in our case here, the patient's bladder was indeed full, and yet the wall was thick. We can also see that the wall is irregular. And yes, the trabeculations, the outpouchings of a bladder under strain, which are classically described, are clearly visible here. Usually, the bladder wall is thin and very regular. It's worth noting that a bladder is easy to analyze in terms of its wall because with urine inside, you can see the wall particularly well. There's a very strong contrast. And here you can see very clearly the thickening along with the trabeculations of this bladder under strain. To help you understand, I've put next to it another ultrasound image of a perfectly healthy bladder this time. And now that we're comparing the two, you can really see the difference. Often, comparison is a powerful tool in musculoskeletal imaging. Of course, making comparisons at the bladder level is tricky. But normally, if you keep doing more and more exams, little by little, your eye will get used to this classic appearance. You see, the bladder wall is very thin, almost virtual, right? You can make it out, right? You can still make it out, of course, but you see this wall that's very thin and very regular, which reflects echoes really well. And right away, when you look at a bladder under strain, your eye is immediately drawn to this thickening, this irregular thickening, sorry, with these trabeculations. I want to point out then regarding the ultrasound that you absolutely need to take multiple slices, use multiple double grids, and that in this patient's case, the thickening is global. You can see a thickening of the entire bladder, which looks like this in every area examined, right? Because you could actually have a thickening that's only localized, which could show this kind of irregularity, and in that case, it would be highly suspicious, possibly a tumor or bladder cancer. Here, it's a generalized lesion, and as we'll see, we've also discovered some other interesting little things right away. Continuing the exam, this time on the other side of my patient's bladder. So we still see this thick and irregular wall, but in addition, surprise, we notice a small diverticulum, and what's more, the connection is perfectly visible. That's not always the case. Sometimes you might just see an anechoic image present on the side of the bladder. You might start to wonder a bit. Actually, you need to apply some pressure to the patient's bladder with the probe. If the bladder is well filled, increasing the intravesical pressure will open up the connection, just like it does here. Because what's happening is that the urine gets pushed into the diverticulum, and when you release the pressure from the probe, well, the diverticulum partially deflates and the urine flows back the other way. So that's another sign of a bladder under strain, a very typical finding. So this time it's a bladder diverticulum. Now in real time, here's what that looks like. We're going to do a sweep. It's called the elevator technique, a sweep along the bladder wall. You can see it's very thick. And after a while, as we sweep, you can see the connection. And if you look closely, I'll let the video play for a bit, but if you watch carefully during the sweep, you'll also see, with the pressure from my probe, urine entering the diverticulum and filling it up. There you go. There it is. We saw it here. We saw the urine go inside. So there you have it, a bladder diverticulum, a diverticulum from bladder strain. I hope you found this clinical case interesting. We were able to review some of the classic signs of a bladder under strain, namely a general thickening of the entire bladder wall, an irregular appearance with outpouchings, trabeculations of the bladder, which gives it that wavy look, and the possibility, as was the case here, of also finding diverticula. Just a reminder, you have access to open ultrasound training. The link is in the description. I'll see you very soon on EcoMap. Enjoy the training and have a great journey into the fascinating world of ultrasound.